Welcome to EPG Pathoshala. I am Dr. Gauri Shankar, Assistant Professor from the Department of General Medicine, Government Medical College and ESA Hospital, Coimbatore. In this module, we are going to see the disorders of endocrine glands. In this, the very important is diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is a group of metabolic disorder in which there are high blood sugar levels over a prolonged period. Diabetes is due to the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. There are three main types of diabetes mellitus. The type 1 diabetes mellitus is characterized by loss of insulin production because of reduced number of beta cells in the pancreas. This leads to insulin deficiency. The type 2 diabetes is characterized by insulin resistance. It is a condition in which cells fails to respond to insulin properly, which may be combined with relative reduced insulin secretion. The most common cause is excessive body weight or not enough exercise. The third one is gestational diabetes. It means the diabetes occurring during pregnancy without previous history of diabetes develop high blood sugar levels. The pathophysiology of diabetes mellitus: insulin is the principal hormone that regulates the uptake of glucose from the blood into the most of the cells of the body, especially liver, adipose tissues and muscles. In case of deficiency of insulin or the insensitivity of its receptors leads to diabetes mellitus. In this picture, the insulin act on the insulin receptors. After that, what happened? It facilitates the absorption of glucose from the blood. Whenever there is a deficiency of insulin or receptor damage, that leads to diabetes mellitus. Some of the signs and symptoms of diabetes mellitus: the commonest symptom is polyuria. Polyuria means increased urination, and this is due to increased blood glucose level. So, increased blood glucose level, there is an increased glucose in the urine. Whenever there is an increased flow of glucose in the urine, there will be increased flow of water. It is called as polyuria. Whenever there is a polyuria, the brain gets stimulated, it leads to increased intake of water, that is called as polydipsia, and also it stimulates the appetite center in the brain, causes polyphagia, that is increased intake of food. And also some of the signs and symptoms of diabetes are the weight loss. This is the most classical symptom in many patients, and also they will have lethargy, and sometimes the patient will have nausea, vomiting or abdominal pain. The complications related to diabetes mellitus are: all form of diabetes increase the risk of long-term complications. These complications is due to the damage of blood vessels. What happens in diabetes mellitus? There is increased blood glucose level. It damages the internal layer of the blood vessels, that is called as arteria intima. That layer of the arteries get damaged. So the damaged blood vessels leads to two complications. One is microvascular complications, another is macrovascular complications. What is meant by microvascular complications? The primary complication of diabetes due to damage in small blood vessels include damage to the eyes, kidney and nerves. So these small vessels in these organs, eyes, kidney and nerves, get damaged, lead to complications. The first one is diabetic retinopathy. It causes damage to the blood vessels in the retina of the eye and leads to gradual vision loss and blindness. The next is diabetic nephropathy. It damages the kidney tissue, lead to increased urine protein loss and eventually chronic kidney disease, that is renal failure. So this patient requires dialysis or kidney transplantation. The next is diabetic neuropathy. It is another microvascular complication. It causes damage to the nerves with the symptoms: patient had numbness, tingling and altered pain sensation, leads to damage to the skin. The next is diabetic foot ulcer. It may occur and can be difficult to treat. Occasionally, patient requires amputation of the foot. Some of the macrovascular complications: Diabetes increases the risk of cardiovascular disease. About 75% of death in diabetes are due to coronary artery heart disease. The other macrovascular complications are the stroke and peripheral vascular disease. So in this picture you can see the diabetic complications, that is stroke, heart attack, peripheral vascular disease. The retinal damage leads to diabetic retinopathy, and also the increased pressure in the eye, that is increased intraocular pressure, leads to glaucoma, coronary artery disease, kidney damage and diabetic foot syndrome. So the diagnostic criteria to say diabetes. Let's see. The fasting plasma glucose value, if it is less than 100, it is normal. If the value between 100 to 125, it is called as impaired fasting glucose. If the value is more than 126, branded as diabetes. After 2-hour OGTT, that is oral glucose tolerance test. If the value less than 140 is normal, the value between 142 to 199 is called as impaired glucose tolerance. This is pre-diabetes. The value more than 200 is branded as diabetes. Or if the random blood sugar less than 200 is normal, if it is more than 200, branded as diabetes. HbA1c, that is glycosylated hemoglobin value, that is the 3-month average blood sugar value. The normal value is less than 5.7%. The value between 5.7 to 6.4 is called as pre-diabetes. The value more than 6.5 called as diabetes. So the major strategies for treatment of diabetes, 3 things we have to keep it in mind. The one is lifestyle intervention, pharmacotherapy and metabolic surgery. What are the lifestyle interventions? The lifestyle interventions such as, if the patient is a smoker, we have to ask this patient not to smoke. If he is an alcoholic, not to take alcohol. He has to take exercise regularly, at least 45 minutes per day. Avoid fatty diet foods. These are the lifestyle modifications. And pharmacotherapy. Pharmacotherapy means we have armamentarium of drugs. A number of drugs are available in the market based on the patient blood sugar values are associated with comorbidities like obesity, hypertension. We have drugs. This pharmacotherapy helps in reducing the blood sugar. If it is not treated by lifestyle modification pharmacotherapy, the next step is metabolic surgery, that is called as bariatric surgery. We are doing in the patients with uncontrolled diabetes, with obesity. In such patients, metabolic surgery is advised. The next endocrine disorder is hypoglycemia. Hypoglycemia is also known as low blood sugar. If the blood sugar value below 70 mg per deciliter is diagnostic of hypoglycemia. What are the commonest causes of hypoglycemia? The most commonest cause are the drugs we are used to treat diabetes. Whenever there is increased dose of insulin, increased dose of sulfonylurea drugs, the sulfonylurea drug used in diabetes, it acts on the beta cells, it favors the release of insulin. Whenever there is increased dose of sulfonylureas, it increases the insulin release, that leads to hypoglycemia. And also the tumors like insulinoma, it increases enormous amount of insulin. What are the symptoms of low blood sugar? The symptoms like shaking, the patient will have sweating, the patient will be anxious, dizziness will be there, patient will be hunger, patient will be with fast heartbeat, that is called as tachycardia, the patient with impaired vision, patient with weakness, headache and irritable. So these are the symptoms will be there in a patient with hypoglycemia. Regarding treatment aspect, treatment of hypoglycemia is by eating food high in simple sugars. If the patient is conscious, we can give from fruit juice or water mixed with glucose. If a patient is unconscious or patient in altered sensorium, that means patient is not able to take food by mouth, in such cases we have to give injection in the form of, that is called as 25% dextrose or glucagon. It is used to treat hypoglycemia. The next topic is hypothyroidism. It is an underactive thyroid. Hypothyroidism is a condition in which the body lacks sufficient thyroid hormone. The cause of thyroid gland failure is autoimmune thyroiditis, that is called as Hashimoto's thyroiditis. First diagnosed in Japan is the name Hashimoto thyroiditis. It is the most commonest form of hypothyroidism. The second is iodine deficiency. The third is the surgical removal of portion are all the thyroid glands in case of thyroid cancer. Clinically, the patient with enlarged thyroid gland in the neck is present, that is called as goiter. So, this is the patient with enlarged thyroid gland in the neck, is called as goiter. So, some of the signs and symptoms of hypothyroidism, usually presented with fatigue, they will be so tired, feeling cold. The patient will have weight gain with poor appetite. The patient always comes to clinic with the hair loss, and also the patient will have the hoarseness of voice, and they have poor memory and concentration, and they have low heart rate, and also some skin abnormalities like paresthesia will be there. So, if hypothyroidism left untreated, the symptoms will progress, leading to severe life-threatening complications like patient will have depression, patient will have cardiac failure, or land up in coma. Hypothyroidism can often be diagnosed by thyroid function test. That is, patient is advised to take the thyroid test like TSH, T3 and T4 hormone levels. And also the ultrasound scan is done to assess the nodule. Hypothyroidism is completely treatable in many patients by taking a drug called thyroxine, that is replacement of thyroid hormone. This drug to be taken in the morning once a day. The next topic is hyperthyroidism. It is an overactive thyroid, makes too much thyroid hormone. The most common cause of hyperthyroidism is it is an autoimmune disease called Graves' disease. What is meant by autoimmune disease? The antibodies are formed against our own cell structure. So, here in Graves' disease, the antibody produced in the body called TSI, thyroid stimulating immunoglobulin, that causes thyroid gland to synthesize too much of thyroid hormone. This Graves' disease runs in families and is more commonly found in women. Hyperthyroidism also may be caused by a toxic nodular or multinodular goiter. That means patient will have lumps or nodules in the thyroid gland. So, this is the lady presented with hyperthyroidism features. You can see a lump over the neck. The symptoms of hyperthyroidism, the patient will have exophthalmos, that is bulging eyes. The patient will have enlarged thyroid gland on the neck. Patient will have increased heart rate, that is tachycardia. The patient will have loss of libido. If female is menstruating, they will not menstruate, that is called as amenorrhea. The patient will be irritable. The patient will be hyperactivity will be there. There will be increased blood pressure, and there will be altered serum cholesterol values. The patient will have increased sweating, abdominal pain. The patient will have diarrhea, heart and tremors in the hand will be seen. Hyperthyroidism can often be diagnosed by thyroid function test, that is TSH, T3 and T4 values. Ultrasound scan is done to assess thyroid nodules, and there is a scan called nuclear medicine scan is done to assess whether this thyroid gland is inflamed or overactive. It can be treated with antithyroid drugs. The most commonly used drug is methimazole, and also the drug called propylthiouracil is used in women in the first trimester of pregnancy. Another option is radioactive iodine therapy to damage the cells that make thyroid hormones. In rare cases, surgery, either a part or entire thyroid gland is done. The next one is gigantism. Gigantism is a condition characterized by excessive growth and height significantly above average. This condition is caused by overproduction of growth hormone in childhood before the fusion of epiphyseal growth plate. It results in 7 feet to 9 feet in height. Gigantism is usually caused by a tumor on the pituitary gland of the brain. Diagnosis: how to diagnose? We can take the random blood sample which shows the elevated growth hormone level, and also the insulin like growth hormone level which is secreted in the liver is also enormously present in patient with gigantism. Acromegaly. Acromegaly is characterized by overproduction of growth hormone in adults after fusion of epiphyseal growth plate. The hypersecretion of growth hormone facilitates the growth of muscle, internal organs and bones, as well as stimulating the secretion of target hormone insulin like growth factor 1. The majority of acromegaly cases are caused by pituitary adenoma, that is a tumor. So, the picture is a patient with acromegaly. So, this lady has increased growth hormone level. So, that leads to clinical presentation like hand and foot enlargement, increased skin thickness, there will be a frontal skull bossing, an abnormal heavy brow and prominent forehead, widening of maxilla accompanied by separation of the teeth, jaw malocclusion, soft tissue enlargement, skeletal overgrowth and thickening, causing many areas of appears very swollen, deep and husky voice due to thickening of cartilage in the larynx. Patient will have weight gain. There will be a vision loss due to optic nerve compression. MRI is preferred imaging method for diagnosing acromegaly. It can help and determine the tumor size as well as compression of the surrounding structures. So, this is MRI. So, this picture MRI picture shows the enlarged pituitary gland. So, and also it is diagnosed by measuring the growth hormone and insulin-like factor level. So, these two things elevated enormously in case of acromegaly, and the mode of treatment is surgical debulking, that is pituitary gland is removed, part or whole pituitary gland is removed. The mode of treatment is pituitary surgery, that is surgical debulking. Surgical debulking is the first choice in acromegaly management because it can reduce hypersecretion of growth hormone and insulin growth factor 1 and reduce the effect of tumor on surrounding brain structures. So, the method they done is through nose, that is transnasal sphenoidal surgery. Through this method they reach the pituitary gland. So, debulking is done. So, this picture before surgery, so the pituitary adenoma, it enlarges, it compresses the optic nerve. So, because of the compression of the optic nerve, there will be a vision loss. So, after surgery, that is surgical debulking, so the optic nerve compression is free. Growth hormone deficiency. The growth hormone deficiency is caused by problems arising in the pituitary gland, in which it does not produce enough growth hormones. It more commonly affects children than adults. So, the pituitary gland with tumor, enlarged tumor compresses and decreases the release of growth hormone. So, that leads to growth hormone deficiency. Growth hormone deficiency occur in childhood, lead to growth failure, that is small stature. Severe growth hormone deficiency in infants, that is less than 1 year, called as infants, results in slower muscle development, so that gross motor milestones such as standing, walking and jumping may be delayed. Children have slow rate of growth. Children will be much shorter than most children of the same age and gender. So, it should be compared with growth chart. In the growth chart, height and weight of standard range should be maintained. If it is not maintained, it is called as small stature. The child will still have normal body proportion but may be chubby. The child face often looks younger than other children of the same age. The child will have normal intelligence in most cases. The older children, puberty may come late or may not come at all. And also, these children will have some psychological symptoms, include poor memory, social withdrawal and depression may occur. And also, hormonal disorders also coincide. So, in such cases, we have to measure growth hormone level, MRI to be done to assess the tumor, pituitary tumor. This can be treated by a recombinant DNA technology growth hormone method. If presence of tumor in the pituitary, it can be managed by radiation or surgical. In conclusion, we have seen various disorders of endocrine gland. Among the various disorders, diabetes mellitus is the most common. India is the capital of diabetes. Being an Indian is a risk of diabetes. So, we have to look for the primary prevention. Prevention is better than cure. We have to focus on primary prevention of diabetes. And also, we have to look for the other endocrine gland disorders like hypothyroidism, short stature, that is due to deficiency of growth hormone. These are also common. This also we have to look for, and we have to diagnose properly, and we have to manage. Thank you.